How you, man?
How are you?
Everybody here. I'm Mrs.
We're missing a lot of each other.
Okay, perfect. Connor,
Who says we're not working?
ready?
Who the hell says we're not working hard enough? Thank you so much, and it's really good to be up here in the Bronx with my good friend Ruben Diaz Jr. And you know, when you go back, Ruben started an initiative here in the Bronx called Not 62. And it was not, attractive and fancy to a lot of people, but he looked at the numbers and he realized that across the city, particularly here in the Bronx, they were rated 62 around healthcare issues, and I'm sure he's going to touch on that. And it just really personifies how important it is to be on the ground and having a quality healthcare system that's on the ground. And that's what Somos represents. It represents a different approach to healthcare throughout our entire city, and it's something that I talked about, and I'm really happy to partner with Somos over and over again. I recall during the height of COVID, seeing them on a cold day in Sunset Park, testing and really being on the cutting edge during that time. And it just shows how this partnership is so crucial. And so I want to thank Henry for being here and just being a friend. We spoke on the Zoom and talked about the great things Somos is doing, and Dr. Maria Molina, who has joined us as well, and the entire medical professional team that really speaks on behalf of those New Yorkers who are often forgotten. From Jackson Heights to Sunset Park to here in the Bronx, it is an amazing team of people that are touching people every day as we deal with the healthcare crises that we're seeing. And COVID only really amplified how bad our sick care system is. We don't have a healthcare system. We have a sick care system. We wait until you're sick, and then we give you medicine to cover up the symptoms of your sickness. And we're saying that must stop. It is going to bankrupt our economy, and it's going to destroy emotionally the families that go through the chronic diseases in the city. Over 30,000 New Yorkers died from COVID-19. Many of them, they came from communities like the South Bronx, South Jamaica, Queens, Brooklyn, all parts of Staten Island. It came from poorer communities. And we know that the impact of this has so much to do with social conditions, comorbidities, the social determinants of health. These are new terms that have been ignored for far too long. It's almost saying, no, healthcare is not waiting until you are sick. Healthcare must be a proactive approach, and the conditions around us, they have a lot to do with the sickness we experience, and we need to start zeroing in on that. And so it's about communicating on the ground, communicating with something that's revolutionary, communicating with your doctor. Your doctor really knows you. And Somos is different from these pop-up urgent care centers that are focused on how many bodies we get in and out instead of the quality of the care that is needed. And that's why we are partnering with them. They understand access to healthy food, as I mentioned in Brooklyn a few days ago, and ensuring the conditions that people are living in and how it impacts our health care. And so our government has failed these communities. We failed during COVID-19 with the inequitable distribution of testing. We failed to communicate on the ground with those who speak different languages. Government failed to follow the advice of many of us to have those credible messengers. Ruben and I talked about this often, about having the right credible messengers speak to people on the ground. We can't continue to believe healthcare is a one-size-fits-all. That is just untrue. There are many different shapes and sizes and languages when it comes down to adequate healthcare. And so Somos Community Care is committed to health equity and wellness for all. and we want to continue to see this expand. This is an amazing network with over 2,800 Latino, Black, and Asian doctors serving 1 million low-income immigrants in New York, and that is so important, immigrants of color as well. They know firsthand about preventive medicine, something that's traditionally is not embraced in these communities. We don't talk about preventive. We have a mindset of emergency rooms of primary care, and that is just unacceptable. And this means being culturally competent. It means affordable access to treatment, rehabilitation, and medicine. And it means doctors that shares the same language and understanding of the community. And that is why we're proud to be here with them today. And so I'm looking like organizations like Somos, who have administered more than 1.5 million vaccines. Because when people are afraid to come in and get a vaccine, it is easy if you speak the language of the people so that they can understand to put their fears to a side. If you ignore this component, you're never going to get the quality health care that you are looking for. And so we don't need to reinvent the wheel. The model is right here. We need to do something that this city has failed to do over and over again. Let's scale up success. Let's scale up success. And so to support this, I'm calling the city to scale their $100 vaccine incentive program to have community-based doctors like Somos continue to move this initiative forward. This population we should be targeting, and this is the population they have successfully reached time and time again. So my plan, in a nutshell, significantly boosting funding for New York Cares, Metro Plus, and Child Plus. Here's a program that we're just leaving on the table. People can be eligible with our H&H system and these other initiatives to get the health care that they need in a very proactive way. Let's get that information on the street and make sure people are aware of that. Using the census outreach team already in place. Let's have that infrastructure. Give them the funding they need to go on the ground and communicate with people in a language that they understand. Treating social issues as part of healthcare by co-locating social services in H&H. You come to the emergency room, you have a chronic disease. While we have you, let's use that information to give you the support you need to deal with those pre-existing conditions. And here, let's look at this. We're hearing a lot of conversations around shoplifting, homelessness. Well, when we arrest someone from shoplifting, how about sitting down with that person with a social worker or local community-based organization to come in the precinct, interview them, why are you shoplifting in the first place, and give them the services they need so that we can start producing a better result and just not a revolving door result. And then forming a unified citywide hospital network that coordinates indigent patients' care, sharing data for more efficient use in a crisis like we just experienced. And then putting in place COVID task health workers directly on the ground in dedicated spaces in low-income areas, including NYCHA. Some of the worst healthcare outcomes are coming from NYCHA. And then turning the COVID vaccination sites that have been set up in lower-income communities into permanent healthcare centers to close racial gaps and chronic illnesses. And so it's about thinking differently. It's about embracing those who are on the ground and listening to them of what we need to do. So I'm excited about being here, and I'm excited about the outcome of what we can do to turn around the healthcare crisis in our city and take it upstream. As I stated so often, too often we go downstream in dealing with these healthcare crises. So I want to turn it over to Henry, and then we're going to hear from Dr. Maria Molina as they talk about the great things they're doing here at Somos, and close out with our Bronx Borough president.
Well, if you're going to call him the Brooklyn Borough President, I'm going to call you the mayor. I think it's important for you all to hear some stories this morning, and why a group of doctors who, over the course of the last almost a decade, have built a movement of people a movement of people who are committed to preventative health care, and why we would stand on the street here today with the man that we hope will be the next mayor of the city. It is true that when we didn't understand much about this pandemic and this virus, that this man stood with us on a street corner in Brooklyn, dressed in a lot heavier protective equipment than we are today, and we will never forget that. But we also believe that not all lives are created equal in this country and in this city. And it's because the healthcare system isn't fair. It's not made for our community. In many cases, it doesn't speak our language. It doesn't filter down to the neighborhoods like this, where Dr. Molina has for many years worked to protect the children of this community. And we've worked diligently, day after day, even before there was a virus crisis, to help reverse what has been happening in this country for a very long time. Because there is no space, quite honestly, between the family doctor and the families and the moment that you walk into a hospital because you are too sick to take care of yourself in a proactive, preventative wellness fashion. You may not know this, but in the last 2 weeks, I've spent some time in a New York hospital. And I've had to face my own crisis and realize that I could have taken better care of myself, and that I myself was not, surprisingly, educated. I didn't have all of the tools necessary to take care of my heart. I share that story with Eric Adams. Eric Adams is a person who took charge of his own health care and the health care of his family, his mother, and worked to reverse the effects of one of the most devastating diseases that occurs in this neighborhood, in our community. I think that's why we believe that he shares our concern that healthcare in this city has to change, and that poor people and immigrants and people of color deserve the same kind of wellness programs and preventative medicine that rich people get. So we are very pleased to stand here today in support of not just his candidacy, but behind his ideas. One of the great examples of how those ideas can change is standing next to me. You never read. She's not a person that you would read about on the front page of the New York Times or see necessarily on a television news program. But she's an immigrant to this country. She came here at an early age from the Dominican Republic. She didn't speak English. She didn't speak English when she went to college. She had to work very hard to put herself through college. She moved back to the Dominican Republic because that's where she felt she had the best chance of graduating from medical school. And then she made the decision already as a mother to come back to this city that she chose to take care not only of her children, but the children of this neighborhood. And that's what she's done for the last several years. And she is one of the heroes, heroic pediatricians, mother of New York City public school children, and the doctor who is like a mother to the neighborhood in which we're standing today, Dr. Maria Molina.
Yeah.
Let's see if I speak English now, right? Well, thank you, Henry. Thank you for such a warm introduction. I am delighted to be here today to represent the people of Somos Community Care and to hopefully provide some community care to Brooklyn Borough President Eric Adams ahead of the upcoming election and of the flu season. As one of Somos more than 2,500 doctors, I have treated New York through every stage of the pandemic. From the scary days of the first wave, when our beloved city stood at the epicenter of the pandemic, to the devastating last winter's surge, to the opening of the Yankee Stadium vaccination site last February. Throughout these phases of the pandemic, I have witnessed firsthand the disproportionate burden placed on New York's low-income immigrant communities of color. Beyond the societal hurdles, these communities face financial, geographic, and language barriers to health care. Each wave has exacerbated these challenges of our low-income communities of color. And with winter around the corner and a threat of another COVID surge, coinciding with the flu season can be devastating. And to prevent this twindemic, it is with quality preventative care that we can do it. But we all know that vaccines, routine health care, and healthcare education will not be enough if it only reaches a selected few. The disparities, the gap, we're not going to close it. We have to provide cultural competency within our healthcare system. Otherwise, our communities are going to be left behind again. Cultural competency doesn't mean that I share the language with my patients. It means that the doctors providing care share the stories, like the story of our President Adam, like the story of Henry, like the story of so many of the families that I treat here, like the story of so many immigrants. We'll share the cultures and their stories. And it is that cultural competency that allows the patients to trust their doctors, to trust the care that we provide to them. And as we head into a flu season, we will continue to meet our communities where they are, here, where they are. This is where we serve. And we'll continue to provide the highest quality care for COVID, for flu season, and for any other challenge that comes around. And it is with honor, it is an honor to have former President Adams here with us to share this message. Thank you. Henry, come so that you could have the honor to do so.
Muchas gracias. And so we're in the BX. So, you know, Ruben Diaz has really been part of this initiative. We talked about him when he as borough president, and we just want to bring up our great borough president from the Bronx, Ruben Diaz Jr. Thank you to our next mayor, Eric Adams. The reason why so many New Yorkers and from every walk of life are going and are supporting Eric Adams is because time and time again, as a candidate, and even before that, you've continued to go around the city of New York, collect the dots, connect the dots, and speak to the real issues that concern real New Yorkers. Your candidacy has not been like others, one of buffoonery, one of circus-like atmosphere. And when you speak of health, just think about it. You could have the most expensive vehicle in the planet, the most expensive car. If you put the wrong fuel in it, if you put something that's not even fuel, it goes nowhere. It will break down. And for too long, our most expensive commodity, our most priceless commodity, which are our children, have had bad fuel put into their bodies. And so how do you expect for a child to learn in kindergarten if they're not being fed well in school? Well, Eric has been taking up this charge for many, many years, even before he was a mayoral candidate. How do you expect for a mom
or an abuelita or an abuelito to be able to take care of their families if they're sick because we're not giving them the right fuel, we're not giving them the right information. We've been able to try to address this in a number of different ways. Hashtag Not62 is our social media outreach to the Bronx, where we want people to get healthy together. We want folks to put healthy recipes on social media so that we can share, show people how to use exercise equipment in the gyms, because so many people are members of gyms, but they walk around the gym aimlessly because they don't know how to use the equipment. There's a way for all of us to communicate how you can use that, those devices and those equipment. We've worked with Steve Ritz and the Green Bronx Machine, where children right now are growing produce, they're growing fruits and vegetables indoors, they're taking it home, they're showing their parents not only what vegetables are, but how to prepare those vegetables. And then now it takes me to Somos. Somos, they are our Avengers. For too long we celebrate fictitious characters and we call them heroes. Our real heroes are those who came to us in our time of need. Henry and Dr. Molina and Dr. Tayat and Dr. Denise Nunez and so many others came to us at the height of the pandemic when we didn't know how we were going to get tested. We didn't know if we were going to get our fair share of vaccines. We were able to convince people like my father and his minister's organization, and I see here Sheikh Musa and those in other religious communities, that they need to go out there and convince their parishioners, convince their membership to get vaccinated. And now we want people to get the flu shot. This is critical. This is important. This is the only way that we're going to move forward. And when it comes to Somos, they're cutting edge because they're getting people who speak the language. You can have all of the medical instruction in the world that you need, but statistics show that when you get it in your own native tongue, it goes even further. And this is somebody who's not just the president. I am also a client. Yeah, you can clap for that. That was a good line there, right? So, when you look at healthcare disparities, there's a whole formula around it. We need our children in our communities to eat right. We need them to have opportunities economically. And the only person who has been talking about this, the only person, again, collecting the dots and connecting the dots and bringing it all together is Eric Adams. And for that, we say thank you.
If you allow me, I would like to say a few words in Spanish. Yo exhorto a la comunidad hispana que vote por Eric Adams para el alcalde de Nueva York, porque él entiende nuestras historias, él apoya que los recursos para salud vengan directamente a nuestra comunidad. Eso es importante para mejorar la salud general de nuestra población, de nosotros los inmigrantes, de nosotros una comunidad de bajos ingresos. Necesitan poner el dinero, hay que ponerlo aquí, en la comunidad, para mejorar la vida, para mejorar la salud, para mejorar la alimentación, para mejorar la educación de nuestra población. Por eso es importante algo que Eric Adams mencionó hoy. Él dijo que la idea del incentivo que se está pagando para la vacuna del COVID a las personas para que se vacunen, se le está dando en ciertos lugares, no se está trayendo aquí a la comunidad. Y nosotros apoyamos 100% que si nosotros queremos aumentar el número de vacunas de COVID, debemos traerlo aquí a la comunidad donde está nuestra gente. Gracias. Voten por Eric Adams.
Yeah! I understood that. So we just want to finish up with two of our amazing advocates on this topic. One is the great Councilman Idanis Rodriguez, and incoming Councilman Oswald Filez.
Come on, applause to the new mayor, Eric Adams. Yeah. And 30 seconds. Let's get it done. Let's get it done. Wealthy New Yorkers who live in the Upper East Side, the Upper West Side, those of you who left to the Hampton, who went to the Hudson Valley, those of you who making the money to eat organic. Most people who die as a result of COVID didn't die just because of COVID. They died because of the pre-health condition. Asthma, obesity, respiratory issue. They were the poorest one. They tended to be most of them Black, Latino, and Asians. We don't want no one New Yorker to die. No one from the wealthy, no one from the middle, but neither one from the working class. Eric Adams is going to be the person that working with someone. Henry could be ambassador in another country. They play a major role helping Biden to be a president. They choose to be here. They choose to stay in this neighborhood. So they are not only here when the board president, the new mayor say, let's address what happened. They saying also, we have a network at the national level to be a partner with the new mayor, Eric Adams. Vamos para adelante, elegir el próximo alcalde, quien va a traer la solución a todas las condiciones de salud que le quitaron la vida a nuestra gente durante la época de COVID. Thank you.
All right, thank you so much. Thank you so much, everyone, for joining today. I'm Council Member Oswald Feliz. I am the proud council member of this district. And I'll say what we all know, which is that the Bronx has been suffering from a health crisis for a long time. It's been suffering from a health crisis for many decades. And it's due to the reasons beyond the control of the people of the Bronx. Number one, we have an asthma crisis because the people of the Bronx don't have access to clean air. And now we have a coronavirus pandemic, which is disproportionately affecting our most vulnerable residents, people from the Bronx, low-income people. Again, due to reasons beyond their control. It all starts with access to the vaccine, but we won't have access if we don't have outreach efforts. People won't truly have access to the vaccine if they don't trust it. The vaccine is safe, and we need to make sure that we're communicating that to every single New Yorker, especially our most vulnerable New Yorkers. So I want to thank our borough president and ex-mayor of the city of New York, Eric Adams, for this very important initiative. Again, you could have vaccination in every single corner of the city of New York. If people do not trust it, what's the point? If people are not taking it because they're hesitating, because they don't trust it, what's the point? So we need to make sure that we communicate to every single New Yorker, communicate but properly communicate, including in their very own language, that the vaccine is safe. We need to do outreach efforts in every single corner of the city of New York to make sure that every single New Yorker stays safe and to make sure that every single New Yorker, including our most vulnerable residents, are not left behind. So thank you so much, next mayor of the city of New York, Eric Adams, for this very important initiative. Honored to be a part of it. Thank you so much.
Yeah, we're gonna do a couple of questions.
See,
We need to
Marsha
walk
is
around
here.
the community. Marsha?
I actually have an off-topic question. I noticed that there's graffiti over here, and there's graffiti all over the city. It's not just in Manhattan, it's all over the borough. The mayor of the city of New York, the current mayor, has sort of ignored that as a problem. And I wonder if you have a problem, a program that you're dealing with it. I point out to you that your Republican opponent going to call for a program today that we call on landlords take responsibility. If they don't clean it up in 30 days, they get fined. So the city will be able to charge them. Also, they have all presidents have spotters to go out and find new graffiti. Would you endorse ideas like that? Do you have your own ideas of how we can deal with this good quality of life issue?
Yes, no, thank you. And I'm happy that he caught up to what I have been saying. If you go back last year, I moved around Atlantic Avenue and talked about just the visible presence of graffiti everywhere, on private property, on homes, and we have to stop it. Second, our shop owners, retailers have been overtaxed enough. We cannot continue to levy more and more tax on shops. What we must do is have a good graffiti removal initiative that's already in place. We defunded it. Let's put the money in. Let's get the young people involved in it, because if I clean graffiti by getting a stipend, I'm less likely to draw graffiti somewhere. And so I think the city has an obligation to come up with a real graffiti removal program, properly funded, which is already in place. Local precincts should identify those locations, partner with youth groups, and start a real graffiti abatement program.
So if you're elected mayor, will you enact a program like that? Because, you know, graffiti casts a shadow about how people feel about New York City.
Without a doubt. Graffiti, garbage, ATVs, homelessness, all of this is feeding into the belief our city is out of control, and it's not. We have to get these items under control, and right away we're going to do a beautification project in our city to show our city is a clean place. I'm sorry?
You're going to fund it in your new budget if you get elected in January?
No, but we're going to do something else as a combination. That is why I have been meeting with business leaders, high-income New Yorkers, and they've been asking, how can we help? They've been saying, Eric, this is the first time, you know, people have come to us and talked to us. They are ready to help the city. It's amazing that we have all these New Yorkers who are doing well and saying, we want to help. Cleaning up this city helps the business community as well as it helps this community.
Eric, I had a question. The mayor's enacted a plan to shift retiree health benefits from GHI and other providers to the Advantage Plus program. A lot of retirees are not happy with this. They point to the mayor's taking money from the Health Stabilization Fund to pay for teachers' raises back in 2014. I'm wondering, do you think this is the right move now, what the mayor's doing, and how would you, I mean, this might be an issue you have to deal with, so how would you kind of tackle it?
Many people don't realize I'm a retiree.
Has your health changed? Your healthcare changed?
That's what I have to look at. I have to look at. I've been reading this. I have my team looking at it. You know, and that is why it was so important to have a mayor that was actually a union member since the days of LaGuardia. When you start talking about cuts in healthcare, they're my cuts. When you start talking about pension crisis, it is my pension. I know what people are going through, and so we're going to take a close examination of this because it's going to traumatize our retirees. And some of the stories I'm hearing about increase in payments, you're on fixed income, this is devastating. You don't become a civil servant to become a billionaire. You become a civil servant to have stable health care, a stable pension, and a stable life. And we cannot destabilize it after they retire.
Do you think that the stress that these retirees are dealing with now, I mean, they say they can't even confirm that they're able to keep their health care coverage. There's an option to do that. I mean, is it right for the city right now to be putting people who are retired, 70, 80 years old, through this type of situation?
I say no to that. I say right now, after serving your city, we should not do any type of bait and switch. When you retire with an understanding, and we need to make sure we live up to that agreement. And so I'm going to take a closer look at this. And we need to, at a minimum, extend the deadline so people can have a better chance and opportunity to understand the real impact of this, because I have been hearing some horror stories.
Can you undo this? This is really a very, very important problem.
Yes, and I have to really look at it and see what are my powers, if I'm fortunate to be the mayor, of reversing, or see how do we don't destabilize retirees. Nothing is more frightening to a retiree that's starting to go through healthcare crises because of a failure in healthcare systems, and now we are double penalizing them. I'm really troubled about what is about to happen.
Amanda, that's morning.
How are you?
Good, how are you?
Good, good.
So the UFT yesterday tweeted out their support of a female council speaker to lead a female majority body in 2022. I was wondering if you support having a female council speaker.
We're fortunate that with the number of council members that are coming in, we're coming in with so much talent. We don't have to search far. There's some great leaders. And I think the council body must determine who's going to be their leader. And I respect whatever decision they do. We are going to have a great leader, and we're going to work together to move our city forward. But I'm in support of whatever the council body. We have one of the councilmen that's here now. And whichever way they decide, I'm in full support of it.
Thank you very much. So we need to go inside, and so we're gonna take groups, only the 4 TV cameras for now, and we're gonna come back for the others. Let's go.
So
Yes.
cameras are going to be allowed in?
Only the